Hello, hello, and welcome back to another episode of the Plant-Based MD podcast. I am your host, Dr. Judy, a holistic physician, and in this podcast, we discuss how you can be whole in mind, body, and spirit. My framework is the P3 method, which stands for plants, prayer, and peace. And my goal here is to share information with you, to share insights, to help you to get on the path of becoming whole so that you can live the full, abundant, prosperous life that God has intended for you. And I'm so excited to introduce to you a dear friend of mine. In today's episode, we are going to be discussing weight loss. My dear friend, Dr. Alicia Shelly, is a board certified internal medicine physician. She's also specialized in obesity medicine and she practices in Georgia. She's also a woman of faith as well. Also, she has a podcast as well. She will tell you more about that. So, welcome to the podcast, Dr. Shelly.
Thank you so much. I'm so glad to be here.
And I also forgot to tell you guys, Dr. Shelly is one of my business besties. We've known each other for like 3 years. There's a few other doctors and myself. We meet weekly to discuss our podcast, our YouTube, our speaking, and all the things that we're doing to help make the world a better place. So I'm just so excited to chat with her today. We've had a lot of conversations on the side about this topic. So I'm really excited to bring this to you today. And the reason why this is so important is because, as y'all know, I am all about balance. I know that in the field of nutrition, in the field of health and wellness, there is often polarizing opinions. And so what I like to do here is bring people that have different perspectives that maybe you may not have considered. And I know many of you are natural, and I'm all about the natural. I don't like taking medications at all. But I wanted to bring Dr. Shelly on because she is practicing in the field of weight loss. As she practices, she prescribes the weight loss medications. And so she has a lot of knowledge and experience about the medications. And I know some of you may have some concerns about the safety of the medications. How do they work? Once you start them, do you have to take them forever? What's the mechanism? So we're going to get into all of that today. But first, before we get started, share with us, Dr. Shelly, your story. How did you come to the field of weight loss?
Yes. So it's not necessarily a long story, but I actually, when I finished residency, I was a primary care internal medicine physician. And the other thing is that I have been battling with my weight since childhood. Like I remember going to an obesity specialist as a kid, trying to get control over my weight. And it was just like a roller coaster. Some days I would lose weight, some days I would gain weight, and it would just be like up and down, up and down. At one point, I had tried almost a lot of diets. So I've done the plant-based diet, keto diet, Weight Watchers, Jenny Craig, lemonade diet, all these different diets. And what I realized is that for me, it has to be a lifestyle change. And I must say is that for me, weight loss runs in the family. It's very chronic. And so I think that was probably another reason why it was so difficult for me. Like I would lose weight, gain it back, and definitely different stressors and things in life kind of played a role. In 2015, I actually underwent bariatric surgery and I was doing really well. I lost 85 pounds. And then about 5 years later, the pandemic hit.
Yeah.
And that's when we started seeing that weight come back. And that's when it just kind of hit me at that point is that I have to make a lifestyle change for myself. And even throughout this process, I do incorporate more plant-based foods. I'm a believer in plant-based, just how healthy you feel and just the science behind it of how not only does it help with different medical conditions, I've seen that firsthand in my patients. And so I definitely am so glad that you have me coming on to talk about a little bit of that balance because sometimes people feel like it's all or none, but honestly,
Yeah.
it's a little bit of a balance for everyone. And everyone's different. Everyone's different.
Yeah, thank you so much for sharing your story and being vulnerable and willing to share that. I know that your patients are very lucky to have you. I've found that physicians that go through a health challenge, it just changes the way you practice. Like since I had my health challenge in the past 3 years, it changes the way that I interact with my clients. It's deeper, more emotional kind of interaction, if that makes sense. Like I understand intimately how they think, which is super important, as opposed to just the behaviors, like understanding the mindset. And also, it gives you a bit of empathy for people with what they're dealing with. And so I can even relate. I've never struggled with weight issues. Genetically, I think my parents and myself, my siblings, we have a higher metabolism, I think.
Mhm.
But in any case, I gained weight during the pandemic as well. I was under a lot of stress and I gained weight, and then I'm in my early 40s now, so that could have been a little bit of it too. I had a little bit of a belly around, a little bit central area. So I understand how that must feel. I wanted to touch on this concept of the weight loss drugs. I know that they are very popular now. Well, yeah, you can share with us, how do they work, and tell us, when should someone have the conversation with their primary doctor to consider whether that's something that they want to start.
Yeah. First, start off with indications. So it's indicated for individuals with a BMI of greater than 30 or above, or 27 plus weight-related comorbidities like high blood pressure, diabetes, high cholesterol, sleep apnea, weight-related conditions. And so, when you talk to your doctor, it's kind of, you decide, if that's something you would like to do. There are many different weight loss medications. Now, you may be thinking to myself, well, we just started talking about this just recently. Well, let's just separate them here. We have oral pills that the oldest has been out since the 1950s. That's phentermine or Adipex. It's a
Okay.
stimulant. It actually helps with curbing your appetite so you don't feel as hungry. Some of the side effects from it, because it is a stimulant, if you're not used to caffeine, it can really cause your heart rate to be a little bit higher. You can feel palpitations, dry mouth. The one thing that people do like about it does give them some energy. So it just depends on that. The other oral pill that we have is 𝗪𝗂𝗪, which is a lower dose of phentermine plus another medication called topiramate, and Contrave, which is not a stimulant at all. It just works at the appetite center, and it causes you not to feel as hungry. And that's a twice daily tablet. Now, those are our pills. Now, what we have as far as injectables, this is newer in the field of obesity. These actual injectables, medications,
So, question. I'm glad that you mentioned the pills, because people often only think about the injections, the Ozempic and the Wegovy. So the pills, they're taken once a day?
So yes, so phentermine and 𝗪𝗪𝗪 are taken once a day. The Contrave is taken twice a day, so 2 tablets twice daily.
Okay, gotcha.
Phentermine has been out since the 1950s. The 𝗪𝗪𝗪 came out between 2013, 2014 time, and then Contrave came out after that. And so they've been available. As far as the overall percentage of weight change, is usually between 8 and 10% for that. And normally with lifestyle changes, it's 5 to 10% too. So now we get to the injectables. What's making them so popular is that now we have an increase in our weight change. So now people on average are able to lose weight with lifestyle change and exercise change as well. I do want to mention that. But now we're talking about 15 to 26%, depending on the study.
Wow, that's
So
major.
it's major. Yeah. So that's why it's getting all this popularity, because now we have medications that can really make a difference in people's lives. Because when you lose 5 to 10% of your body weight, it actually can change your metabolic comorbidities. So your blood pressure can be better controlled, your diabetes can better control. So we're really seeing a change in people's medical outcomes. Now, let's talk about the more popular ones. Now, the injectables, or what we describe as GLP-1s, they were discovered in the 1900s. And I mean, I want to say, now I'm forgetting the exact time. I want to say it's 1970s when it was first discovered. But it actually became a medication that we utilize for diabetes. It reduces people's gut so they're not as hungry, but it also helped with balancing out people's blood sugar. It was first started out with Bydureon and Byetta in the early 200s. And so we've been using this for diabetes, and then Ozempic came out in 2017.
Since the 2000s?
So
they've been using that since the 2000s. So it's
This
been out for a
particular
while,
class.
but for diabetes.
For diabetes, exactly. And I've been using, Ozempic came out in 2017, and we've been using that for people who have type 2 diabetes. And what we notice, and what I notice, is that it really helped people with curbing their appetite. There were other medications between Byetta and Ozempic, but really Ozempic, you could really see a difference in people's appetite. So they were able to finally get the medication Right. And then they started doing more studies. And that's when we started seeing Wegovy that came out. And now I'm forgetting the exact year, but it was after the pandemic. I realize now we have before the pandemic and after the pandemic,
Yeah, I
but it was
know.
after the
Life is
pandemic.
before and after pandemic.
Exactly. I'm like, man, when is this? When is the timeline?
Yes.
So then now with the Wegovy, they did studies and they showed that people were able to lose 15% of their body weight. And now Manjaro came out, and that's for diabetes as well. Now, the difference between Manjaro and Ozempic is that Manjaro targets two hormones called GLP-1 and GIP, whereas Ozempic just targets GLP-1. And then now we have Zepbound, which is the same medication as Manjaro, but it's just now for weight loss. So it can be very confusing because people
Hmm.
use Ozempic, Manjaro interchangeably, but just so that you understand, Ozempic and Manjaro are only for type 2 diabetes, whereas Wegovy and Zepbound are just for weight loss. And so I will just talk about Wegovy and Zepbound since we are just talking about weight loss. The reason why it's important is that when you're trying to get it covered, the insurance won't cover it if you don't have type 2 diabetes. Like, we're getting a lot of pushback.
Oh, interesting. So Ozempic is for diabetes,
Yes.
but the Wegovy is the same drug, right? The same, yeah.
Same drug,
Yeah, people are
just for
using
that.
them interchangeably, even like on the internet and YouTube videos and whatnot, they're using them interchangeably. So that's a
Yeah.
good, important distinction to make note of.
Yeah.
So they've been around for a little bit. I don't know why they became being popular now.
Well, because the celebrities are using
Celebrities are using them. That's
them.
true. That's
Yeah.
true. The celebrities are using them and they're dropping weight like
Yeah,
this.
yeah, dropping weight. I mean, Charles Barkley was on his show, King Charles. He's like, I use Manjaro and I can't find it. And now they have the spike in Manjaro, and he's lost weight, So, people look at the celebrities and they're like, oh, well, I need to be on that. So, but
But
that's really what happened. I mean, I don't know for sure which celebrity, but at least the rumor mill
mhm.
was that a certain Kardashian was on Ozempic, and that's why people
Oh,
started
wow.
getting on it. I don't know how true it is,
That's
but that's
hilarious.
what the rumor is.
But is it dropping weight too fast? Because your weight should drop like 1 to 2 pounds a week, right? So talk to us about how fast you should lose weight safely. What's a safe amount? Because
Yeah.
sometimes people will come to me and they will say, I want to lose 20 pounds in like 2 weeks or 3 weeks or something like really short. And it's like, that's too fast. It's really not realistic.
You're absolutely right. I tell my patients 1 to 2 pounds per week is what to be expected. Interestingly enough, when we look at the studies, it's actually a gradual change in weight. Now, when we look at weight loss in general, and you may have noticed this too, you may lose a pound, gain a half pound, lose 2 pounds, gain a half pound. So it's kind of like this up and down type motion. But when with the medications, you're still losing maybe a pound, but it's just a little bit more consistently. So you're losing
Oh,
that
I
one
see.
pound a week. So a lot of times people are like, well, I need to lose weight for my wedding. And
Right,
it's
right.
2 weeks. Girl, you have missed the boat. Like I said, this needs to be a lifestyle change. And with all of
Right.
the studies, everyone had to make lifestyle changes. So they were reducing their calories, they were eating, they were exercising in addition to the medication.
Mm,
So we cannot say that you take the medication as a magic pill. No, ma'am. It is
right.
a combination of lifestyle change and diet. And I find that the people who are more successful are in their mind thinking that this is a lifestyle change. So I'm making the changes. I'm eating healthy.
Hmm.
I'm exercising. I'm being more consistent with it. But usually at 1 to 2 pounds. And don't
Okay.
let people on TikTok tell you differently that they lost
Right?
40 pounds in a month. No, ma'am. They must have starved themselves. The rest of us, we need
One
to
to
like
two pounds a week. This is it's like a marathon. It's not a sprint.
absolutely, absolutely.
I tell people it didn't come on fast. It's a process. So it takes a process to also, lose the weight. Same thing with inflammation. So you talked about how the medications decrease your appetite, decrease your cravings. And that's something that a lot of people struggle with. Cravings, craving food at night. It's hormonal. So can you just touch on the hormonal aspect of hunger and the impact of inadequate sleep as well as chronic stress on that?
Oh, definitely. So, with hunger, we have an appetite center in our brain. And it can tell us, like when we can see something, it kind of dings to that brain. And then all of a sudden our mouth starts to water and we're like, oh, let me eat this. Let me eat this candy that's here, that's sitting here. And it's all with us seeing it. It hits that brain receptor, our mouth, it tells our mouth to start getting ready for it. And then all of a sudden we're like, let me eat this. Let me take this piece of
Ooh.
candy. So a lot of times our cravings are, it's just a normal function. So the one thing I would say when it comes to stress and sleep, so with stress, we can increase our cortisol hormone, which can lead to not only chronic cortisol and elevation, can lead to more fat being deposited. It can lead to more weight gain outside of that. And then, of course, it can be a vicious cycle. If you're going through a lot of stress, even depression, sometimes, first of all, with depression and stress, you don't have the motivation to want to get up and exercise. You don't want to have the motivation to eat healthy. You want to kind of curb your, that emotion. So sometimes we've been brought up as kids that food is comfort. When
Mm-hmm.
we are feeling bad, our mom will say, hey, get some ice cream and you'll feel
Yeah.
better. Or, or as a reward, we get a
Mm-hmm.
gold star, we get like a piece of candy. So this is stuff that's been
Yes.
ingrained even as kids. So
That's so
when,
true.
when we go through like a depression or anxiety, sometimes we
Yeah.
turn to food for comfort. Now, there's some people who do the complete opposite. They don't eat at all when they're going through
Mm-hmm.
this, but other times people do eat for comfort. And so it can be a little vicious cycle. You're going through a depression, you don't have that lack of motivation, your cortisol levels are high, but then on top of that, you start to gain weight, which makes you even more depressed. And so it's like this vicious cycle, and depression gets worse. So definitely that's kind of how stress can affect your weight. When we look at sleep, so there's been studies that noted that when we don't get enough rest, and we're talking about less than 5 hours of sleep per night, number one, you're tired, you don't have the rest that you need. So throughout the day, you may be drinking caffeinated beverages to stay awake, you may be eating to stay awake, things that kind of help stimulate you, which actually does lead to weight gain. But in addition to that, they notice that your hunger hormone called ghrelin is higher in somebody who's getting less rest. And your leptin hormone, which is the hormone that tells you that you're satisfied to stop eating, is lower. So you're kind of more triggered to eat more, especially when you're not getting enough rest.
Yeah, that's very important to make note of. And I felt that when I used to work night shifts, I
Mhm.
noticed that I craved junk food more. And so I left night shift for that reason, for my health. And so
Mhm.
I'm now a believer in night shift. I personally think if you're trying to lose weight, it may be something to consider switching to day shift if you can, because your circadian rhythm is just going to be thrown off by working night shift. And so I think of it like you're fighting an uphill battle, basically. If you're not getting enough sleep,
Yeah.
the ghrelin and leptin hormones are out of balance. And then during the day, you're trying to make good health decisions. But it's difficult because you're fighting the hormones. And then if you add depression, anxiety, or a stressful season in your life on top of that, your brain is in fight or flight mode.
Mhm.
Think about like the amygdala and the sympathetic nervous system being in overdrive. So you're making decisions from an emotional state, and you're seeking foods that are going to bring you comfort to kind of alleviate the anxiety, the sadness, or the pain that you're feeling emotionally. So that's why now when I'm working with clients and even, on my platforms, I don't really talk so much about the activity of eating this or eating that, but the foundation, I believe, is your mind, your emotions, your mental
Mhm.
health, your social connections, whether you have healthy relationships. And I don't know how you feel about this, but I think even being in a toxic relationship or a stressful marriage or having a stressful job impacts the food choices that you make, because your cortisol is going to be higher. You're probably not getting sleep. And so then you're just going to be hungry during the day. So, one thing that I think people can do is look at these environmental or social factors in their life rather than just jump to a diet plan, an exercise plan, or even a medication, because the medications work so much better when your emotional state and your mental state and your sleep is good.
I agree. I think it's important that we all take stock on where we are and find ways to improve that, especially if you're going under a lot of stress and sleep. You may be in a job where you can't work day shift. And if that's the case, there are some things that you can do by number one, bringing your food, having tons
Yeah.
of water so that you can, throughout your shift, you're drinking water, you're not feeling as hungry, you have your food already laid out for you prior, and then making sure that you get your rest. Like when it's time to go home, you have blackout curtains so that you don't see it, so you're able to get a better rest as well, especially those people that can't get off the night shift. But I agree with you. It's all important. The sleep, the stress, physical activity, how you eat is important. And it's part of not just like a moment in time. This has to be a lifestyle change and it has to be a complete 360. Mhm.
Yeah, and I'm so glad that you say that because with the popularity of these weight loss drugs, I'm finding
Mhm.
that there are a lot of virtual clinics
Mhm.
that are popping up doing weight loss, and they are prescribing the medications, but some of them are not really advocating for the lifestyle changes. And some people that seek them out are not interested in the lifestyle changes. So, one point for y'all to make sure that you make note of is that medications work so much better when the diet, the exercise, and your mind is in a good place. So, medication should never be the only thing that you're using. If you're using them, you should also be optimizing your lifestyle, everything else in your life. So, I wanted to transition a little bit to the side effects about the drugs because when I looked online and YouTube and everything, I saw an abundance of videos from
Mhm.
holistic practitioners, chiropractors, naturopathic doctors, even doctors
Mhm.
speaking negatively about the side effects of these injectable weight loss drugs, and particularly the GI side
Mhm.
effects. So, can you talk about that as far as what are the side effects of the medications and what is the incidence or the likelihood of someone having those side effects? Because, as we know, side effects affect different people. Like you may be at risk for it, but if you're not at risk for it, how likely is it that you will have it? Because I think when you watch things on YouTube, you can think, oh my goodness, if I take this medicine, everybody has GI complications, everybody gets pancreatitis, right? So
Yeah.
give us the facts about what actually the side effects are and the complications.
Yeah. So, like I said, these medications have been out for a while, especially the injectables in the field of diabetes. And so there is a contraindication just in general for these the GLP-1s in general. And that is if you have a family history of medullary thyroid cancer, which is a very rare cancer, or if you have a family history of multiple endocrine neoplasia type 2, then it's not recommended for you to be on these medications. And let me tell you why that is. When they were doing these studies, they noted in rats that they started having a thyroid C cell tumor. It has never been seen in humans, but it has been seen in rats. And
Mm.
therefore, this has the black box warning that, hey, because of this complication in rats, if you have an increased risk, a family history or a personal history, then you should not be on these medications because of what was shown in rats, but it has not been shown in humans. I do have some patients who are always very nervous about that. They're
Yeah.
like, "Oh my gosh, what if I have hypothyroidism?" Totally different process. Totally different.
Okay.
Hypothyroidism is when your thyroid kind of just stops working. And there's multiple reasons why that happens. And so that has nothing to do with cancer, nothing to do if you have hypothyroidism, you can still be on this medication. It's just those who have that family history of medullary thyroid cancer. And the way, like I mentioned, the way this medication works, it targets the stomach where it slows it down. So because it slows it down, or majority of the side effects or the most common side effects are usually going to be your GI side effects, which is your nausea, your vomiting, diarrhea, constipation, most top four. Everyone is different. So when we look at the studies and the clinical trials and all the people who were on this medication, specifically with Zepbound with nausea, around 23-25% of individuals develop nausea. So that's like one quarter of the people. So not
Mm.
everyone's going to get nausea with this medication. The other thing I would say is too, if you do get nauseous, definitely there's a couple ways how you can improve that by number one, eating food that are less fatty, making sure because sometimes medications you don't feel hungry, so you don't eat. that's when also the nausea happens, or avoid overeating too. So making sure that you're eating at least 3 to 4 meals throughout the day can help. The other thing that I noted is that sometimes people take other people's medications. That sounds kind of crazy, but
Yes,
they
they do.
do.
They do.
And I've heard stories where somebody took their parents' medication who's on a higher dose. So sometimes when you start at a higher dose than the lowest dose, because there's a lower dose of 2.25 of Wegovy and 2.5 of Zepbound that you should start off with for the first month and then increase it to the next dose. And I do find when people increase it very suddenly because they want to get the best weight, they want to get the weight fast, that tends to be at risk for nausea. So the one good thing with Zepbound is that you can be on a maintenance dose at a lower dose than the highest dose. So you don't have to keep tapering up with it. And I do find for some people at lower doses, they have more tolerability and they're still losing weight. So that's the one thing I would say to kind of avoid that. For some people, they can develop, you mentioned pancreatitis. There is a risk of pancreatitis in general with this class. Usually it's less. So when they did the Zepbound studies, they noted at those people who were treated with Zepbound had around 13 people develop pancreatitis out of, I think it was like 700. So it was very like 0.1%. So it was a very small amount of people that developed this. However, if you have a history of pancreatitis, it's not contraindicated, but it's probably recommended to not start this medication because there is that risk. Gallstones is another side effect. Now, gallstones can happen in individuals who lose weight. Specifically, we see this in people who get bariatric surgery because they're losing weight more frequently, more fast. They tend to develop gallstones. So that something can be why you can see that here too. But if you had your gallbladder removed, you're okay. It's just there is a risk and we just have to monitor that.
Okay, so it sounds like the risk of pancreatitis is small, and it's more something of a concern for people that have a history of pancreatitis, or if you take other medications that can increase your risk for pancreatitis.
Yeah.
What about ileus and bowel obstructions?
So that actually was not seen in the clinical trials. Sometimes I do find if people are constipated and they're chronically constipated, that can put them at risk for a bowel obstruction or that. But that wasn't actually high on the list of adverse reactions. So I find that sometimes because it does slow your gut down. And I'll say this, sometimes that can lead to some small bowel obstruction, but there's no contraindication for those who have a history of small bowel obstruction, whether they can take this medication. But it is important to watch it. And I think this is why it's important to kind of go to your doctor who knows you, because then they may be tapering up slower on this medication than just going to the highest dose if you're going to a clinic. Like sometimes they have these med spas where they don't really, they don't really monitor you. They're not, you don't have that clinician who knows your history and who can taper up slowly. They're doing it with an algorithm per se. And so, you're going up, but you're not, and some people, when they're going up, they just kind of like push past. They're not really addressing the symptoms they're having, and they just kind of keep going up on it, and then they can have a bad outcome. So it's important, I think, to go with a doctor who knows you and who can taper up slowly, especially if you already have a history of some GI issues to start.
Okay, so it sounds like the main side effects is the nausea and vomiting.
Yes,
And
that's
what
the biggest
percentage
one.
of people experience that?
So in the Zepbound trials, it was around 20%
Okay.
between that. Yeah,
And
20, so a
Wegovy is
quarter.
about the same?
With the Wegovy, I believe so. Yeah, I'm sorry. I don't have those percentages memorized.
No worries. Well, still, it's lower than what I thought and what I think most people probably think. And is that a dose dependent? Some drugs, you have that side effect initially, but then it wears off. Is it like that? Or is it if you have nausea and vomiting, you're going to have that for the duration of the time that you take the drug?
Not necessarily. In my clinical practice, I do find people, if we start off with some nausea, that it does get better for them.
Good
And
to know.
we just kind of taper off slowly, or we go back down and they do pretty well. So it's just it's just following up with your patients on that too.
Okay, awesome. This is so helpful. I've did some of the training for obesity medicine in 2021 to learn about the drugs, but it's been a while, and I don't keep up with the drugs because that's not what I do on a day-to-day basis. So this is very helpful even for me. So I wanted to ask you about the concept of once you get on the medications. I know the Obesity Medicine Association teaches that obesity is a chronic disease and these medications ought to be prescribed lifelong. But what about the person who says, I don't want to take this forever. I just want to take it to help jumpstart my weight loss, to help curb my appetite and my hunger for a few months or something like that. And then I want to try and wean off of it. And I ask that because with hypertension and type 2 diabetes in my space and where I, come from and work, I have had patients who have been able to wean off of those medications with making lasting lifestyle changes in their diet and exercise, but particularly diet, more of a plant-based diet, cutting out processed foods. So with regards to weight loss, and I don't know the answer, I'm really just curious, is it possible to prescribe it on a short-term basis, or is that inappropriate to prescribe it in that way?
Recently, there was a trial called 𝗪𝗪 trial. It looked at Zepbound, and it looked over like 72 weeks, and they saw people who, lost weight. At that 72 weeks, some people were stopped with the Zepbound, and some people were continued on with Zepbound. And what they found with the people who continued the medication even longer, I want to say it went 80 some weeks. I don't remember the exact date now. Exact time frame. They found that they lost even more weight. So it was an average of 26%. For those who stopped losing weight, not everyone gained the weight back, but people did gain around 14% of their weight back when stopping it. And what I find in clinic, what happens is that these medications, not only are they slowing down your gut, but they are GLP-1 receptors in the brain. So they're targeting the appetite. So it helps. And the one thing that people say is helpful with these medications, it kind of turns off that food noise. So sometimes that food noise starts to come back and you may find that you're eating more than what you have been. So to answer your question, whether it's inappropriate, no, of course not. I have patients who don't want to be on this long term. They want to get off medications, and I'm like, that's fine. But it is so important as you're on this medication that you are changing your diet, that you are exercising, we're implementing the sleep, the stress modifications, drinking water, making sure that you're kind of doing all these little small things to help maintain, like that, make it part of a lifestyle. And it takes time to kind of implement these things in your lifestyle. But once you're ready to get off, if you're going to continue what you're doing, right? Once you're getting off these medications, and because it's a lifestyle change, I can't stress that even more. It's a lifestyle change. And then as you start to taper down, say it for the last person.
Well,
and
that's
it may
good to
just
know.
sorry, just to finish. So then as you taper down on it, you can see how your body responds. And there's some people who don't, that get off of it and they're able to maintain their weight with their lifestyle. And there's some people who aren't. And you just kind of see how your body responds and you act accordingly.
Oh, that's good to know. So if someone wants to be on it but doesn't want to be on it long term, what's the minimum time frame that you think would be necessary to lose the weight, to start implementing some lifestyle changes, like 3 months, 6 months, a year?
So it really depends on how much weight they need to lose.
Okay.
And I say this because everyone's different. So there's not really a time frame. There are always going to be people who respond better than others to the medication, and they may lose weight a little bit faster. And then there's other people where it is slow and steady. It's maybe 1 pound every other week, so, if your goal is to lose, 10, 20 pounds, then you may not need to be on it longer. But if you're trying to lose 50 to 100 pounds, you may need to be on it longer. So it just depends on how much weight you need to lose to get to where your goal weight is. But, it's individualized.
Okay. I love that. I'm all about an individualized approach. There's no one size fits all. And that's why it's really important to find a doctor that you trust, especially for people who have been marginalized, people of color who experience healthcare racism, sometimes stop going to clinic. And when they do come, this is like an aside, when they do come, it's an emergency and they're coming through the ER. I see this a lot when I was working as a hospitalist. They haven't had blood work in a very long time. So I just want to put a plug in there in the middle that make sure you find a doctor, a primary care doctor that you trust. You can message me if you are having trouble finding one. I know a lot of people, so I can probably connect you. But then also, if you are dealing with weight loss, I recommend a obesity medicine doctor personally, because I'm an internist and I know that there's things that I learned when I did my obesity medicine training. I didn't go through to certification like you did. I did like two courses.
Mm-hmm.
There was a lot that I learned that I did not learn in my internal medicine training. And, I've been in practice for like 11 years now. And so for you watching, listening, I would recommend to actually see an obesity medicine certified physician. You can go to what's the website where they can search for one? Is it OMA?
Yep.
Yeah.
obesitymedicineassociation.org, and they have a list where you can search for obesity medicine in your area.
Yeah, it definitely makes a difference, because I thought that I was equipped to manage weight loss, but I realized that there's a lot of bias in healthcare against people with excess weight. So there's a problem with the language that we use, when we speak to people that have excess weight. It just changed the way I interact with people who are dealing with weight. So I'm just grateful that I had that opportunity to take those courses. And I was going to go through the certification, but now that I'm more doing the holistic kind of wellness thing, I didn't think that I needed the certification, but I learned a lot. So that's why I just wanted to say that even if you have a primary doctor, I still think it's good to see an obesity medicine specialist, or if they're lucky, they can see one like you who does primary care and weight loss, so they can see one and take care of both.
Absolutely. Yes. Definitely.
Yeah.
So we do a combination. So it works out. It works out.
Yeah. And you speak a lot too. You're like speaking a lot at conferences about weight loss. So doing some good stuff. So
Yeah.
what about the cost of these medications? Because I know that's an issue, and I've done a little bit of chatting to some of my friends who have practices. I know someone who prescribes this virtually for people, and he's figured out a way that he can get it, not the brand name. So can you talk about the price, the cost of the medications? Does insurance cover it?
Yes. So alrighty. Now, I will say this. If you're on Medicare, Medicare does not cover weight loss medications unless you have like type 2 diabetes, because then it will cover Ozempic and Wegovy. Also, if you have coronary artery disease or a history of a stroke or a history of a heart attack, now Wegovy is FDA approved to help with reduction of heart attack and stroke.
I saw that.
And those who have a
study.
history
Yeah.
of heart disease, stroke, vascular disease, coronary artery disease, you can usually get it covered that way. Now, for those who have commercial insurance or insurance that's provided by your employer, it's important that you actually ask your employer if they have an obesity rider. So an obesity rider is a little bit extra, so not all employers offer this, but it's basically stating that they will cover obesity medication and weight loss surgery. And so it's important to kind of ask your employer, because if they do not check off that they cover this, then what happens is that your insurance won't cover it. So regardless if it's Blue Cross, Cigna, or whatever, it's usually employer driven whether they cover weight loss medications or not. If you were to pay out of pocket for these medications, for Zepbound, if you have commercial insurance, it's around $550 per month. For Wegovy, they just recently lowered their price. So I want to say it's around $1,000, $1,500 a month. I'm not sure the exact price now that they lowered it. For those who have commercial, you're paying out of pocket. Now, there is something, you've probably seen this on the side of the road, where it says compound semaglutide or compound tirzepatide. Now, how I like to describe these medications is that these compound semaglutide and compound tirzepatide, any compound medication, is what I would describe as a knockoff. So similar to, as my patient told me, the Great Value brand. Yes, at Walmart. So it's not the actual medication that you get from the pharmacy. So the compound is created by the pharmacist using different chemical background that is available for people to take and kind of put together. It has not been studied as far as whether it loses weight or not. With that being said, because this is individual pharmacists, people who have a background in chemical, they did chemistry and all that jazz, it's not clear how well it helps. And so there's no studies to back it up. and you don't know if what you're getting is what you're getting, because they're drawing it up, and you don't know what they're doing and how that particular spa, they could be drawing up some of the medication plus some saline. You don't know.
Mm.
So that's why, I would recommend maybe staying away from the compound unless you have a trusted source where you're getting it from.
Interesting. So that means that must vary from pharmacist to pharmacist.
Exactly. Yeah. I mean, they may have like a wholesaler that gives them like the different vials,
Yeah.
but it can vary.
Because I
Mhm.
know it's cheaper with the compounded ones.
It is. It is. But
So
that's because
they're
it's not.
becoming popular.
Yeah, well, because not everybody can get access to it. So it's one way how people can afford it and get access to it. The problem is, the reason why they're able to do this at this time is because there's shortages of the Wegovy and the Zepbound. And the way the FDA has a loophole. So if there's a national shortage, then people can make the compounds and to be able to help with that. So that's how they get around it. But now the different manufacturers are starting to sue the compounding places.
Oh my gosh. They're always trying to sue.
Yeah, they're
They
like,
gotta
"Oh,
get
we're
their
getting our
money.
money."
They're like, don't
Yeah.
play with my money.
Don't play, don't play. So yeah, so I don't know how it's going to work out. I know just there in the newspaper they said that one of the companies were suing a popular compounding company. So we'll see what happens.
Oh, wow. All right. So now I want to switch on diets because I feel like there's a never ending diet war, right? There's people that are on carnivore diet. They say they lost 50 pounds on it. And there's people on a fully whole food plant based diet. And they're like, this is the best diet. Everybody should be whole food plant based. Then you have the whole 30 people, the keto, the people that do intermittent fasting. And it gets really confusing for people to know what kind of diet should they be eating. So are there any basic, simple principles that people can take note of with regards to diet and losing weight?
Yeah. So the one thing I will say, they have done studies that have compared all these different diets together. And the one thing that they notice is that the people who are on these diets lose weight. And the reason is that they all will allow you to lose weight, but it just depends on you whether this is the proper diet for you. So let me
Mm.
give you some examples, right? We mentioned the keto diet or the low carb diet. So keto diet is a very, very low carb where you're eating less than 20 milligrams of carbs a day. Now, for
20
somebody who
grams,
20 grams, yeah, sorry, 20 grams of carbs a day, which is a lot.
which is
It's
difficult.
difficult.
I
I
eat that
tried
in
to.
one meal, probably.
Oh, are you kidding me? That's a snack.
Yeah, that's a snack.
It's definitely not a diet for me because I tried getting down to 100 grams and
Yeah.
I thought life was coming to an end. But anyway, for some people, it really works for them, especially if they tend to
Mm-hmm.
have a history of diabetes, pre-diabetes, things of that nature. Keto diet can be helpful. But the one thing about keto diet is because you aren't eating like fiber, vegetables, you're eating more protein, you're eating more fats, you can have an increase of your cholesterol. So if you have already high cholesterol, then keto diet is not for you. So it's important that you have that individualized. And then also the question is this something you enjoy? My
True.
mom was on keto diet and she lost weight, but she loves vegetables and fruits. So it wasn't something she was able to continue to do because she's like, well, I'm missing my fiber. It's affecting my
Mm-hmm.
digestion. I'm not regular. So, the question is, number one, where are you in your medical conditions? Number two is this something you like? And number three, is this something you can continue? Because all these diets, you can lose weight, but if you can't continue it, then it's just not helpful. You're going to gain the weight back as soon as you go back to your old diet. So that's my thing. The other question you ask, what are some principles that you can use? And so the one thing I will say, they've done studies looking at processed foods or ultra processed foods versus less processed. Now, an example of ultra processed food. All right, let's say if you have an apple is unprocessed at all. But if you take that same apple and you make it into applesauce, now you're processed. And if you take the same apple and now you make it into like an apple pie where you're adding in the sugar, all these other components, now it's a little bit more processed. But it was more healthier for you when you had the apple. And so when we look at foods that are ultra processed, when we think of fast food, very processed, hamburger, your french fries, this is in order for them to mass produce this, they have to
Mhm.
put extra salt, extra fat, different processed foods to make it more stable on the shelf. And so, with that being said, the studies show that when you're eating more ultra processed foods, you actually gradually tend to gain weight. If you're eating foods that the same people who were eating ultra processed foods gained weight, then the next week they started eating less processed food and their weight gradually decreased. And this was with keeping exercise the same and whatever activity the same. So, focusing on less processed foods, foods that you're cooking at home, foods that you're, eating that aren't, they're not like TV dinners that have a lot of salt in it. Even if you have to eat food from a can, getting that low sodium canned food will be more helpful for you than the one that has a lot of the salt in it. So less processed food is important. I recently went to Jamaica for a mission trip, and the food is very fresh. It's like farm
Yeah.
to table. And
Yeah.
it makes a huge difference. I was like, man, I done lost weight being here in Jamaica, and I didn't really eat differently.
Mhm.
I just ate as normal. And so when I come back and I'm like, man, this food is not the same.
It's not the same. The
More
food
processed.
here is designed, I think, to keep you addicted to it. Like the food in
Absolutely.
America
Hmm.
is, I don't know if this is a word, obesogenic. Obesogenic.
Yeah. No, I
It
agree with
makes you
you.
gain weight.
Yeah, I had more GI issues coming home than I was there. I was like, "What was going on?" But it's just
Yeah.
the type of food that they're bringing to us. Like, we're eating chicken, or this is plant based, but let's say we're eating more. Well, you're in Jamaica, so you eat jerk chicken or whatnot.
Or
But it's
fish, yeah.
coming. Your fish is coming from the sea.
From the
It's
ocean.
coming
Yeah.
from the farm. Like, it's just right there. So it
Yeah.
makes a huge difference. The other thing I would say is focusing on more complex carbohydrates than your simple carbohydrates. An example of
That's a good
simple
one.
carbohydrates are going to be your cookies, your cakes, your candies, more processed foods where you have more complex, which is your whole grains, your bread. Even bread that has whole grain is better for you than white
The
bread.
white.
So focusing on more of your complex, more nuts, more grains that have more protein in it, like couscous, things of that nature, quinoa. So definitely I'd recommend that. The other thing is water, making sure you're drinking water. We have an abundance of water, but we don't drink it at all, or
That's so
barely.
true.
Barely. I always have to
Yeah.
ask people to quantify how much water they drink, because if you ask them, "Oh, I drink a lot of water," and I'm like, "Well, how many glasses?" "Only two." And I'm like, "No, no, that's not enough. That's not enough water."
Yeah.
So
And
making
sometimes when we think we're hungry, we're really thirsty.
Exactly, exactly. So those are just some of the, principles I definitely would recommend. Making sure you're getting your fruits and vegetables, your fiber.
Oh,
Fiber is
yes,
huge, which
yes,
is very
yes.
important, extremely important.
Fiber.
Helps with more regularity, helps you to feel full. Like, it's so important that you're getting that in. So making sure you have that balance is important.
So, how about when people say they want to treat themselves and they're like, I'm going to have a Snickers bar, I'm going to eat some Bojangles fried chicken and French fries. What is your view on that frequency of it?
Mhm.
Or should people, if you're actively trying to lose weight, should you not eat those things at all?
I would recommend not to eat those things. And the reason
Not
being
to
is that
eat them at all.
not to eat them at all.
Uh,
Yeah.
so,
The
not no
reason,
moderation, guys. I know people like to say moderation, eat this and that in moderation.
yeah. Well,
That
and
the
the
weight loss
reason,
doctor has spoken. She
now I
said
may
it's
have to I may have to step back here and just
I
say
say
this
the same
caveat.
thing. So I was like, I
Yeah.
wanted to know what you was gonna say.
Yeah, the reason being is that sometimes you eat these things and you go down this rabbit hole, right? And
Yeah.
then it's like, "Oh, let me eat this, let me eat that." And so, I definitely believe that you should have some moderation, but you may be able to substitute things, right? So,
Hmm.
let's say if I love ice cream, right? Maybe you can eat like more of a sherbet, more of a fruit-based
Or
type of
yogurt
whole treat. Yeah, or
with
yogurt to kind
fruit.
of help. Yeah, so if you're eating one piece of cake, it's not going to kill you, but maybe you can have a more healthier piece of cake, like
Yeah.
something that you cook at home versus something that you're buying over the counter. So,
Or a
you know,
smaller piece.
smaller piece.
Yeah.
Yeah.
I think
So,
so.
I wouldn't necessarily go just because it makes it harder sometimes. Because when does it stop, right?
Yeah.
"Oh, I'm gonna have this cheat meal," and then it turns into a cheat week,
Week.
like,
Yeah.
So it's just kinda like making sure that you kinda have that balance.
Yeah, I say don't even keep junk food in your house. Like that's what I do. And
Oh,
I find that
oh,
when
yeah.
I do have it in the house, like I bought some ginger chews the other day, not
Mhm,
anything seriously junk food, but I like ginger. It's like these ginger
mhm,
chews that have sugar
mhm,
in them. And I'm pretty much cut out sugar, but sometimes I buy these and it's like a
mhm,
bag of, I don't know, 30 in there. And every day I'm eating one of them. And I'm like, okay, let me put this in the freezer. And today I'm like, should I just throw these things out because they're in the house and it's like I can't stop eating them?
mhm. Absolutely, I say don't keep it in your house because when you are craving it, if it's not
Yeah.
there, it's not like you're gonna get in your car and go to the store.
Right.
So, it's better just to kinda, like,
That's the
not have
thing.
it. Don't have the temptation there.
That's
I
what
have
I did with
patients.
ice cream. Like I don't keep ice cream in my house anymore. And when
Mhm,
I do crave ice cream, if it's late at night, instead I will eat fruit. I'll eat some fresh fruit. Maybe have some. I buy this vegan unsweetened yogurt.
mhm,
Forager is the
mhm,
one I like,
mhm.
and that's it.
And I think it's easier that way because then you're not I mean, it may be there, but you don't have it available, so you eat what you have, and it's
Hmm.
probably healthier for you than if you were to have that junk food.
Yeah. And
Now
then you
let's
also feel good too when you're
Mhm,
making healthy decisions for yourself. I don't
mhm,
know. I feel guilty when I eat too much sugar. I actually don't feel good when I eat processed food at all. Like sugar, processed
mhm.
food, junk food. I feel like I'm doing something that's destructive for my
Yeah.
body.
Oh, no, I agree, agree. The last thing I'll say too, let's say you have a spouse or you have
Oh,
people in your house
that's a good
who are
one.
bringing this in here. Ask them, just first of all, have a conversation to ask them kinda like, tell them why you're doing it, and if they can have the junk food, but they need to put it in a place where you don't know it where it is.
That's a good
Because
one.
because people, they're your significant other may be so helpful. They're like, "Well, I know you like this, so I'm gonna buy it for you." But you're like, "I don't need it. I
People
don't need it, please."
sabotage.
They will sabotage you, and they may do it because they love you and, but just have that conversation, and they may forget, but just keep reminding them, put it in a place where you don't know about. Don't eat it
Oh,
in
that's
front
so
of me if
good.
you will,
Yeah. A lot of my
because
clients
Mhm,
and patients say that the other person in the house is not interested in changing their diet. So
mhm,
it's hard for them to stick to it when the other person is not on board.
yeah. And sometimes it's just sharing with them why you're doing it. And even if they're not listening, but just say, "Hey, I'm not saying you can't have it, but can you just put it in a place I don't know
Yeah,
so
that's
that
so
I'm not
good.
yeah, that I'm
That's
not
a good
tempted."
tip. Yeah.
Mhm.
Yeah. Cause it's family, a team. You're supposed to be united and wanting to support each other in the goals that the other person has too.
Oh yeah, absolutely. Absolutely. And the one thing I'll say about your kids, I've had some patients where they'll make changes and they will be surprised that their kids are looking at them and they're actually making those changes. So if you're concerned
Hmm.
about your kids and their health, sometimes by you making the change, you never know what your kids watching. I think the saying is more is caught than taught. So even if
Yeah.
you talk about it, if you're actually living it, that actually is a bigger instruction for your children. Mhm.
Yeah, that's so true. And I don't like how at the fast food restaurants and restaurants in general, the kids' meal is usually something unhealthy, like hot
Yes.
dog, a burger, chicken nuggets.
Mhm.
Like, why can't they eat regular food, but just a smaller portion?
Absolutely. It's very interesting why they do that. And I don't know if maybe it's just the parent at home, like, but definitely they really do cater to more unhealthier options for kids. Mhm.
Yeah, even the kids' meal. So this has been so good. So we talked about Ozempic, Manjaro, the drugs, the weight loss drugs, the oral ones as well,
Mhm.
the indications for them, BMI above 30. We talked about financing, the cost, and discussing if you have an obesity rider, as well as the side effects of the medications. Turns out
Mhm.
they're not as common as we fear from what you watch online. And
Mhm.
then we also talked about diet, the importance of minimizing the processed foods, the added sugars, the fried foods, the junk foods, and really ramping up and increasing your intake of fruit and vegetables, as well as making sure you're getting adequate sleep, you're addressing your stress, and then also having a support system. So if there's someone in your house who's not on board with the diet, having a conversation with them and sharing with them your why and if they are going to bring the food in the house, Dr. Shelly suggests have them put it somewhere where you don't know about it. These are such good tips. So thank you so much, Dr. Shelly. We had a blast, and I'm sure we could talk for another hour. So share with our viewers where they can find you, because I know that you have a podcast. So share with us the name of the podcast, where they can find you on Instagram and Facebook, and tell us about your business.
Yes, so you can find me at my podcast, Back on Track, Achieving Healthy Weight Loss, as well as on Instagram, TikTok, Facebook, LinkedIn at Dr. Shelly MD. And then I'm also on YouTube at Dr. Shelly MD.
Awesome. And you also do Ironmans and marathons, right?
Yes,
Yeah.
yeah.
Every time I see you or hear from you, you're like, oh yeah, I went here to do this Ironman and marathon. And so our little group, we just laugh because I'm like, I'll do a little 5K, but I'm not trying to do no Ironman.
I know we all have different things we
I
enjoy.
know. I
It helps
love
me
it
stay
though.
active.
One day I'm gonna be there. There's a
Yes,
marathon
yes.
in Bermuda for 24th of May. It's a half marathon. Bermuda's
Oh,
small, so
yeah.
it's like 13 miles. It's from one
Yeah.
end of the island to the next, kind of. And I'm
Uh-huh.
like, maybe one year I'll do that. Maybe. We'll see.
Yes, and I do find that when I actually set a date and pay for the race, I'm more apt to actually kinda get
Oh.
prepared, go out, go make sure I'm
Mm-hmm.
running so that I can be able to complete that race. So, hey, you never know. Give yourself about 6 months to kinda get there, but you can do it for that half marathon
Yeah.
in Bermuda.
Yeah, I have to start planning 6 months in advance. Maybe next summer. Maybe we can both go and do it
That'll
together.
be fun. I love
Yeah.
I've never been to Bermuda, but I love the pictures.
Yeah, we actually
I
have
love the
a
goal.
an athlete that's, I guess, kind of famous. Her name is 𝗲𝗏𝗄𝗏, and she does
Mhm.
triathlons. And we're
Oh,
very proud of her because, it's a small island, so we don't have a lot of famous athletes or anything like that. But we're proud of 𝗲𝗏𝗄𝗏.
mm.
So thank you so much, Dr. Shelly. This was truly an honor having you on the podcast. And to our viewers, be sure to follow her podcast and be sure to like, subscribe, and follow this podcast on YouTube. And if this episode was helpful for you, feel free to share it with someone who you know can benefit. Thank you so much for tuning in, and I will see you on the next episode. Bye.